afternoon, and welcome to Tisch College's Civics Life Lunch event entitled Public Health and Public Service with Congresswoman Lauren Underwood. I'm Katrina Moore, the director of the Africana Center here at Tufts. The Africana Center is excited to co-sponsor today's talk, and I want to thank our other co-sponsors, the Political Science Department, the Fletcher School, and the School of Medicine for their support and collaboration. Tisch College has many events and civic leaders visiting virtually this spring. Later this week, we will host the former chair of the Republican National Committee, Michael Steele. And next week, we will host Julie Carrick-Dalton for a book talk about her new cli-fi, or climate fiction novel. You can register for those opportunities by visiting tischcollege.tufts.edu/events. Later, during today's program, you will have the opportunity to ask questions of our speaker. Please submit questions via the Q&A feature at the bottom of your screen at any time. Tisch staff will be in touch with you directly for additional instructions. And now, I'm delighted to introduce Congresswoman Lauren Underwood and Dean Alan Solomont. Congresswoman Lauren Underwood has served Illinois' 14th Congressional District since 2019. She is the first woman, the first person of color, and the first millennial to represent her community in Congress. And she is the youngest African-American woman to serve in the United States House of Representatives. Congresswoman Underwood currently serves on the House Committee on Education and Labor, the House Committee on Veteran Affairs, and the House Committee on Homeland Security. She also serves on the House Democratic Steering and Policy Committee and the Congressional Gun Violence Prevention Task Force. In addition to being a member of the Congressional Black Caucus and the LGBT Equality Caucus, she is a member of the Future Forum, a group of young Democratic members of Congress committed to listening to and standing up for the next generation of Americans. A nurse by training, Congresswoman Underwood has extensive expertise in the healthcare and public health arenas. Prior to her election to Congress, she worked with a Medicaid plan in Chicago to ensure that it provided high quality, cost-efficient care. And as a senior advisor at the U.S. Department of Health and Human Services, she helped communities across the country prevent, prepare for, and respond to disasters, bioterror threats, and public health emergencies. She also helped implement the Affordable Care Act. Congresswoman Underwood previously taught future nurse practitioners through Georgetown University's online master's program. She is a lifelong Girl Scout, and on a personal note, I met Lauren and her family at our church's Vacation Bible School summer program when she was a young child. So I'm proud to highlight her local ties to the Metro West area. Yay, Lauren. Joining Congresswoman Underwood in conversation today is Alan Solomont, the Pierre and Pamela Omidyar Dean of Tisch College. Dean Solomont previously served as the United States Ambassador to Spain and Honduras under President Obama. A lifelong social and political activist, He previously chaired the bipartisan board of directors of the Corporation for National and Community Service, which oversees service programs like AmeriCorps, Learn and Serve America, VISTA, and Senior Corps. He got his first exposure to national politics as a Tufts undergraduate in 1968, when he worked as a page at the Democratic National Convention in Chicago. He later served as the party's national finance chair and played key roles in 5 presidential campaigns. Dean Salamat has always been a lifelong supporter of Tufts University. Over the years, he has been a visiting instructor and senior fellow, founding board chair, and now Dean of Tisch College, parent, alumni, and trustee. Now, it's my pleasure to introduce Congresswoman Lauren Underwood and Dean Alan Salamat.
Well, Katrina, thank you very much for the generous introduction of both of us. And thank you for your leadership at the Africana Center and for being such a good partner to Tisch College. I want to give a special thanks and shout out to a member of the Tisch College Board of Advisors, who I believe the Congresswoman knows, Suzanne Seiden. Suzanne is a good friend. She's an alumna of Tufts University. She met her husband at Tufts, and she, I believe, has one child who is an alum and one child who is here. So Suzanne, thank you very much for helping us arrange today's conversation. And let me just say how important we think the Future Forum is. Given the importance of young people and democracy today, we just actually, Chair Emeritus, Congresswoman Stephanie Murphy was just virtually on campus to speak at an event. And we've also worked with Eric Swalwell. So congratulations on that piece of your work. But let's turn to you. You have had such an impressive career, and you are only 34. You're a year younger than my oldest daughter. But your path has not been linear. Can you walk us through your professional journey from nursing to public policy to serving in Congress, and tell us what motivated you at each turn and what ultimately inspired you to run for Congress?
Well, Dean Salamat, thank you for having me today. I am so delighted to be with you virtually on campus. I was diagnosed with a heart condition when I was in elementary school, and it was the early experiences, the care that I received from my pediatric cardiologist and the care team, including some great nurses, that inspired me to go into healthcare. I picked nursing, and I was excited about this profession because I knew that, one, I'd always be able to have a job, but two, it would be an opportunity to really impact the health and well-being of people throughout my community. I was always attracted to public health, but the second semester of my freshman year, I took a class at the University of Michigan that changed my life. And it was a course called Policy and Politics in Nursing and Healthcare. And I was introduced to this field called health policy, where I learned that, my interest in politics, which had just been, extracurricular, if you will, could be my career. And I could do this every day, and I was hooked. So I spent my summers interning on Capitol Hill. I interned for then Senator Obama. I was down at the Centers for Disease Control and Prevention in Atlanta. When most of my colleagues in nursing school were on mother baby or working in ICUs, I took a completely different course, even that early in my training. I graduated and was in graduate school when the ACA was being developed. It was being written and debated in the House and the Senate. And so had a firsthand look at all of that work. And so I knew that I wanted to be part of it for my career. So when I graduated from Hopkins, I got a master's in public health and a master's in nursing. I started working as a career federal employee at the Department of Health and Human Services to implement the ACA. I did private insurance reform, healthcare quality and Medicare, and the ACA reform. So anything the Obama administration was getting sued on related to that law was in my portfolio, and I loved it. I was a young professional. I was doing meaningful work to extend coverage to 23 million Americans, and I was proud every day. to go to work. I had an opportunity to join the Obama administration, and I ended up working on the Ebola team. And we did public health emergencies and disasters. Ebola, Zika, that mosquito illness, you might remember, the water crisis in Flint. I stayed until the very last day, but I knew I couldn't help the Trump team take away healthcare coverage from the American people. So I decided to return home to Illinois, work for this Medicaid plan, but happened to go to a town hall that my congressman hosted during the time of Obamacare repeal. And he made a promise. He said he wasn't going to support a version of repeal unless it protected coverage for people like me with pre-existing conditions. I believed him. And then unfortunately, 2 weeks later, he broke his word and voted for the American Healthcare Act. And I felt betrayed and I was mad, and I decided, you know what, it's on, I'm running. And so I launched a campaign, beat 6 guys in a primary, beat that long-term Republican incumbent in the general, and got sworn into Congress in January of 2019.
It's a great story.
Yes, sir.
So like you, I got 2 degrees, but mine were both bachelor's degrees.
Okay.
Well, after graduating from Tufts in 1970, I went to nursing school.
Yes.
University of now the University of Massachusetts Lowell, and received a bachelor's degree in nursing. And like you, never practiced nursing, but developed deep respect for both the art and the science.
Mm-hmm.
So let me ask you, I want to talk about the ACA and even the Ebola crisis, but how does your training as a nurse inform your policy and legislative work?
Yes, it has been so critical to my approach to this work. So throughout my career, I've always had this lens of how can I help improve the health and well-being of the American people. This population health approach has been essential, but also being data-driven and evidence-based and methodical, right? It's so important to follow what we call like the nursing process, critical thinking, you investigate a problem before you jump into an intervention, that type of thing. And I remember very early on in my clinical training, they taught us how to connect with our patients, right? And as you know, there's often just a few moments when you walk into that room, you introduce yourself. Hi, I'm Lauren. I'm your nurse today. You look into their eyes and you build trust. If that patient is nonverbal for whatever reason, right, you do that with a family member. It's the only way to have an effective therapeutic relationship, even just for that shift. And it's the same skill set in this role as a member of Congress. So many people come to me in moments of vulnerability. And oftentimes there's this there's an intimacy to the exchange where they are revealing things that they don't usually share with other people, and they are desperately seeking help. And I'm relying on those early skills I learned as a student nurse. And so that's been really important. The other piece I just have to say is when I was in graduate school, I worked as a public health nurse, and I was in graduate school during the H1N1 pandemic. And so, during that time, we saw how mass vaccinations can work. That's when we developed the pan-flu plans that were supposed to be the foundation for this COVID response. And so many of those recommendations and those plans were not followed. It was a policy choice by the Trump administration. And so that's also the early career experience I had during that pandemic has really influenced how I approach this pandemic and my work in the Congress.
If I'd had this conversation with you many years ago, maybe I would have run for Congress after nursing school.
Well, sir, we love your leadership as an ambassador and would welcome you in the House.
Well, the only House I'm going to be representing is right here in my own house. In any event, let me just follow up on what you just shared with us. You did work at HHS on strategies to deal with public health crises. As we continue to grapple with COVID, the pandemic, how can we better prepare ourselves for the next public health crisis?
Yes. So, so often these public health crises don't manifest as, nationwide global pandemics. Oftentimes it'll be, an extreme weather event, right? So think about what happened in February across the country, particularly in the South, Texas, Mississippi, these communities that weren't prepared for the extreme cold. We talk a lot about extreme heat, and there's a lot of data and evidence, but the opposite can happen. And there's real healthcare impacts, right? People die because these communities are not prepared for what? The public health impacts of climate change. This is what we're witnessing. And so, my experience in that role showed me kind of the breadth and the range of disasters and public health emergencies that can have an impact on not only individuals and families in their healthcare, but the whole community and their health status for years to come, right? We saw that with the BP oil spill, right? The lingering physical and mental health impacts. We've seen that after school shootings or mass shootings in communities, right? Physical health impacts, but also mental health impacts after tornadoes and wildfires, right? So the natural disasters, these other kinds of disasters are very, very, very important. And my fear, to be candid with you, is that they will continue while we're still battling the pandemic. And here's why this is a problem. Our local public health departments have been chronically underfunded for decades. These are folks that have been, well, first of all, their expertise is enormous. They've been working at the very top of their capacity before the pandemic. And now we've layered on COVID, and that's pretty much what a lot of these state and local health departments are doing exclusively. They have a very limited budget, very few staff oftentimes. And then what happens if there's a disaster? An unexpected disaster, or some other public health emergency. We're seeing opioids and substance use disorders and deaths escalate, overdose deaths. We're seeing other infectious diseases, right? People aren't getting their routine immunizations, for example. We're lagging behind, right? You can just see how there could be other outbreaks concurrent with COVID. And we need to continue to invest in our public health preparedness infrastructure in order to protect the American people.
You know probably as much as anyone about the Affordable Care Act.
Oh yeah, I love the ACA, unashamed. I'm an ACA evangelist.
So nothing is perfect.
No.
So what improvements do you think the Congress should take up to strengthen the ACA or improve the ACA? And what has the pandemic taught us about both the importance of the ACA and also maybe some of its shortcomings?
Yes. So, one thing that we've seen, I'd say two things. One is I think folks took for granted how that everyone in their community may have access to healthcare. And what the pandemic has shown is that is just simply untrue. People, I think, regular Americans are much more familiar with the concept of disparities. They're more familiar with the concept of equity. Why? Because COVID has shined a bright spotlight on who's more likely to get diagnosed with the virus, who's more likely to die. And it's because of these access to care issues. It's because they may lack some worker protections like paid sick days, right? Paid leave, but it all influences this healthcare system. And some of those issues the ACA just didn't touch. And there's an opportunity to improve the health and well-being of the American people by expanding the way that we traditionally think of health reform. So that's number one. Number two is before the pandemic, cost was such a problem, right? The American people just found their healthcare costs to be spiraling out of control, and care was becoming inaccessible. For many families, the first healthcare dollar that they'd spend every month was on that premium, right? To get that insurance card in their wallet. And in my community, it's not uncommon for people to be spending 20 to 25% of their incomes on premiums for Obamacare plans, right? And so we called it the Affordable Care Act, but for many people, that affordability piece was missing. So in the last Congress, I wanted to tackle that issue. And so I introduced a bill, it's called the Healthcare Affordability Act, that says that no American would pay more than 8.5% of their income on premiums. So think about it. If you're a family of four making $100,000, which is typical in my district, and you're spending $25,000 a year on premiums, you get that down to $8,500. That's considerable savings that then allows folks to see their provider, right, to get a procedure, to afford their prescription drugs. We passed that legislation out of the House, but it didn't move in the Senate last Congress. Well, President Biden agreed with our approach, and we were able to get this program for 2 years included in the American Rescue Plan. So it's now law. And so here's what's so extraordinary about this. The Biden-Harris administration opened up what they call a special enrollment period with the belief that Americans should not be uninsured and lack access to care during a pandemic, right? And so people can log on today on healthcare.gov, whether you're uninsured or just have really costly employer-based coverage, right? And you can check out your options and get care under this new expanded tax credit system, which means that you won't pay more than 8.5% of your income. It's extraordinary. So when I think of where we need to go from here, we can lower costs, we can cover more Americans, right? Deal with this uninsured issue, and make sure people are getting the healthcare that they need during a time of a global pandemic.
Well, congratulations on that.
Thank you.
Success.
Thank you.
The American Rescue Plan has a lot in it related to healthcare. So what other aspects do you want people to know about that are especially important to their health in this new $1.9 trillion piece of legislation?
So, we know that there's been so much made of the economic investments, right? The $1,400 economic impact payments, but then there's also significant funding for vaccine distribution. Every state got basically hundreds of millions of dollars. In Illinois, we got $275 million to speed up vaccine distribution. Very important. But then there's also pieces on the coverage side. So in addition to the legislation I just described, there's provisions that allow for individuals who are experiencing unemployment. They've been unemployed all this year to enroll in an Obamacare plan without paying any premiums. Huge. Affordability is at the forefront. We have a provision in there that COBRA, so if you lost your job but your employer extended COBRA to you, that the federal government would pay 100% of that COBRA benefit. Very significant. And then I do a lot of work on maternal health, trying to end our nation's maternal mortality crisis. Black women are 3 to 4 times more likely to die of a pregnancy-related complication than their white counterparts. This is a disparity that's existed my whole lifetime. I'm 34, and we've not seen, prior to this, really any large federal initiatives to solve this problem. Well, in the American Rescue Plan, we have an incentive for states to extend their, what we call postpartum Medicaid coverage from the traditional 60-day cutoff. So 60 days after someone has a baby, they lose their healthcare coverage, to extend that to a full year postpartum. This is important because a full quarter of all maternal deaths happen in that extended postpartum period where folks didn't have coverage. So we're creating an opportunity to save lives. And in a COVID environment, that's so significant because we've seen that there's a real difficult and often deadly interaction between COVID-19 and pregnancy for some vulnerable populations. And we want to make sure that they have the healthcare that they need as well.
There was actually a study recently about the differences in infant mortality between Black women and white women. Mm-hmm. One of the findings is that when Black women went to see a Black obstetrician, a Black physician, that actually the gap narrowed.
Yes.
But speaking of this,
choice is important, but also having a provider that understands the lived experience of their patients often enables them to provide higher quality care.
You're sort of leading right into one question after another that I want to ask, because so the pandemic has exposed some big challenges for healthcare workers that already existed long before the pandemic. You and I both know that as a nation, we face a serious nursing shortage, an aging population that is living longer, but in need of more attention and care, and an increase in chronic illnesses across all age groups. What do we have to do to invest in and support our healthcare workers at all levels?
It's so important. And we need to start by supporting nurses who've been on the front lines of this crisis. So last year, I teamed up with Senator Jeff Merkley to unveil a sweeping agenda to support nurses during the COVID-19 pandemic, including access to testing and treatment, PPE, which has been just such a problem in many communities over the last year, paid leave, childcare, and mental health resources. You know, we want to talk about burnout. This is gone beyond burnout, and we need to embrace our frontline healthcare workers with these mental health resources that, you know, folks have said that they really need. But then, as you said, we also need to invest in our healthcare workforce in a way that will extend beyond this public health emergency. And so Senator Merkley and I also teamed up to introduce something called the Future Advancement of Academic Nursing Act, which is a historic $1 billion investment in schools of nursing to strengthen nursing education and grow our nursing workforce. So these are dollars that can be used to enhance student enrollment and retention, especially for students from disadvantaged backgrounds, right, which often face barriers of particularly getting that 4-year nursing degree, that BSN. It also offers funding to support initiatives to modernize nursing education and curriculum. So make sure that we have, you know, the technology, which again, all of our nursing schools just haven't had the resources to offer that kind of modern curriculum, retaining faculty and hiring new faculty, expanding clinical opportunities, which, you know, clinical placement remains a big barrier to our ability to educate more nurses in this country. And then expanding programs to train our nursing researchers and our scientists, which is so important, right? These are investments that will improve the health and well-being of people across this country for years to come, and really ensure that we'll be better prepared for the next public health emergency whenever it arrives, right? It's not if it comes, it's when it comes. Right. We'll have the workforce prepared to respond.
And that legislation was enacted.
No, we're still working. We're still working to get support, but I'm encouraged because, you know, everybody knows a nurse. People understand our value within the healthcare system. And I think that there's bipartisan support for investments in nursing education. And so the key is we need a greater investment, right? A more generous investment, one that meets the need across the country. And that's really why we've asked for this historic $1 billion investment.
Well, you're right. Everybody does know a nurse. My mom was a nurse, but not everybody understands the science of nursing that you're. That's right. And so what you're laying out is really quite ambitious, but also quite important. I'm just going to tell my friends at the University of Massachusetts Lowell nursing program that they should keep an eye out for this.
Yes.
But let's segue and talk a little politics, if we may.
Oh, great. Mm-hmm.
One of your other favorite subjects, I'm sure, at least one of mine. So you've won 2 close elections to represent Illinois' 14th congressional district, which includes historically Republican suburbs of Chicago in the north and western part. In 2018, you were one of the 41 Democrats who unseated an incumbent Republican, which paved the way for Nancy Pelosi's election as Speaker of the House. But your 2020 race wasn't called until 9 days after the election, when you would finally declared the winner by a little over 5,000 votes. So what was the key to winning both elections in obviously what must have been a very much of a split district? And how did the 2020 election differ from 2018?
Yes, sir. So one of the early experiences I had in the 14th congressional district was door knocking in that first campaign. Mm-hmm. And we had farmers tell us that no Democrat had knocked on their door in 10 years. No Democrat at any level. And we found that in some communities, folks weren't even running for office. And so it was not hard to then understand why communities would appear bright red on a map, right? When you look at this kind of swing district, we had many of those bright red areas, but then we'd show up and it turns out healthcare, for example, was the #1 issue for farmers in our community. So my district is half rural by geography. And, you know, the rural economy is very significant for our local economy. And I would say culturally, right? It's very important in our community. And so we, you know, found out that farmers were looking for a great healthcare solution, and that there was a lot of shared values and commonalities and an approach that they embraced and that I embraced. And so we were able to earn their support in that first election. This is significant because the Farm Bureau's #1 issue was trade. And many candidates, I think, skipped over talking to the farmer and went straight to the Farm Bureau and missed an opportunity to connect with their voter on the key issue. We show up. We show up in cul-de-sacs, right, in neighborhoods, in people's living rooms, and sit down and talk, but most importantly, listen to what those key issues were for voters, and were able to earn their support. That carried over into our 2020 campaign. We ran a completely virtual campaign. And that was really tough. You know, I'm a public health nurse, and in a pandemic with our set of volunteers that, you know, are really across the lifespan from middle school age, making phone calls to, you know, 80-plus-year-olds who are willing to knock doors, I'm not going to send them out in a pandemic and risk exposure. And so we showed it could be done, right? Use innovative approaches. We had the highest turnout ever in our congressional district in this 2020 election. I got more votes than anyone has ever earned in history. But then my opponent got the second highest number of votes ever. And so with this kind of turnout and enthusiasm, one key demographic that I know has been so important to the work that you do at Tisch College has been around young people. And we find for young people, at least in our community, so much of the conversation is not a persuasion conversation, candidate A versus candidate B. It's about, do I even take the time to vote? Will my vote count? Does it even matter? And is it going to be so cumbersome? We talked to a lot of young people who told us they thought it was like going to the DMV. One line to the next line, it's confusing. Do I have the right form of ID? Do I need to bring something else? And when we explained to them, you know, how straightforward and easy it was to vote, it was novel. It's like they had no idea. And then they started spreading the word to their peers. And we found that they took advantage of the early voting. Yep. That was available during the pandemic, and it was really key to our electoral success.
You know, as soon as we get the voter files, we'll be able to look and see what the youth turnout was in your district, and I look forward to that. And by the way, speaking about rural districts, a colleague of yours in Michigan, Alyssa Slotkin, who represents Michigan 8, sounds like a similar district with a really significant part of it is a rural part, and her big issue is lowering the price of prescription drugs.
Yep.
Also a healthcare issue. Sadly, you faced a lot of racist vitriol during your campaign, and especially during the most recent one when your opponent weaponized your race and refused to accept it. You won the election, even to this day. In an interview with Elle magazine, you said, "I feel like I'm in an institution that was not built for me, that my presence is disruptive in so many ways." Could you tell us what you meant by that? And can the institution you refer to be made more representative of the country that it is supposed to serve?
What an excellent question. Thank you so much. So let's talk about the reality of the United States Congress. So first, the Capitol building, beautiful building, iconic, built by slaves, okay? Enslaved people. So that's number one. And I think that folks like to gloss over that history. Maybe it makes people uncomfortable, but the fact remains, I am the youngest Black woman to ever serve in the Congress. And I was elected in 2019. The United States, we're talking about centuries of representation. And there's never been someone like me in this chamber. Before my election, the youngest Black woman was Barbara Jordan, icon. Right, incredibly effective, powerful champion for healthcare issues, honored to follow in her footsteps. But it had been many years since we'd had that kind of young, strong voice. Okay, also, we also know that there have been so few women in history serving in the Congress. And with our election, the class that entered in the 116th Congress, we had this whole cohort now of millennials serving concurrently. So I was not even the youngest member of our class, right? Alexandria Ocasio-Cortez, the youngest woman to be elected to Congress. We had Abby Finkenauer, Katie Hill, Max Rose, Josh Harder, right? Those are all the ones my age and younger. And then there is some under 35. On the Republican side, they've actually elected some additional young people, Madison Cawthorn, Kat Kammick, right? There's some new young conservative voices that have joined the Congress. I think that that's very positive. But in an institution that was originally, think about those early Congresses, the constitutional Congresses in our country, who was welcomed as a member of Congress?
Mhm.
Wealthy, white, male landowners. That's who this institution, in the formal ways, the rules and procedures, the informal ways, the customs and norms, that's who this institution was designed for. And so when you have the most diverse Congress in history that I've been able to serve in, that's where that disruption comes from. In the last Congress, the loudest, boldest, most powerful voices coming off Capitol Hill were the voices of women. And with the exception of our speaker, those are women of color. And so when I hear comments from people, even in my community, saying, wow, we used to be so unified, right? Can't we all just get along? Part of that is, yes, people are feeling and witnessing the real partisan divisions, but the other piece, I think, is related to this diversity, where they're not used to seeing and hearing certain voices and people with different backgrounds serving in this chamber, bringing their full lived experiences and pushing for change the way that any other policymaker would. And is there disagreement? Yes. Does it have to be as violent as we've seen? No, absolutely not. But I do think that, some people are very uncomfortable with the idea of this changing American electorate and the commiserate diversification of the Congress.
We were very fortunate to have Speaker Pelosi speak at one of our forums earlier this semester. And we learned from her that when she arrived in the Congress in 1987, not hundreds of years ago,
That's
1987,
right.
There were only 25 women members in a 435 member. There was no women's restroom off the House floor.
That's right.
Then, so.
And one other fact that you might be interested in, there's only been, I think, like 55 Black women who have ever served in Congress, ever.
Wow.
There's only 2 Black women who have ever served in the Senate, Vice President Harris and Senator Carol Moseley Braun from Illinois, right? And so when we think about, the progress that we've made, so much of this is recent history. In my lifetime, recent history. And so, we have a long ways to go for full representation, but I think that folks are seeing how much representation matters.
Right. Let me ask you something. You mentioned the younger group of conservative members of Congress.
Mm-hmm.
And I know there's been a lot of tension among members.
Oh, yeah.
Since January 6th, and it's even worse than tension. Are you able to get along any better with the Republican members that are closer in age to you? Or is that, in other words, do young members of different ideologies and parties get along any better than the older folks?
I wouldn't say get along better. I will be very transparent about my personal challenges, which is, as a human being, I have not had the experiences of being personal friends with older men, right? Like I just haven't had those professional experiences or life experiences where, 65, 70, 80-year-old men are my friends.
I'll be your friend.
I would love it. I'd love it. And so, I think that it's easier for me in particular to build relationships, no matter around ideology, with men in my age range. And so for that reason, I have been able to,
right,
find friends on the other side of the aisle. So for example, like Brian Stile, he's young, he replaced Paul O'Brien. He's my neighbor to the north in Wisconsin. We have a great working relationship. And, then there's like proximity, right? So like my next door neighbor, our office suites are next door to each other. We have a good relationship. It's this guy, Tim from Tennessee. His district and whole life is so different than mine, but we get along, things like that. But I don't have, the opportunity because of the pandemic to get to know this current group of freshman conservative members yet. I haven't had the chance to get to know them yet, but I'm looking forward to it.
Well, let's hope that day will come soon. I want to ask you one last question, and then we're going to open it up to some
Sure.
student questions. But what's your advice to the students who are watching and listening to this conversation who want to pursue careers in healthcare, public health, and government service?
Well, we need you. And please just go for it. Let the work lead you. I think that so many of us type A high achievers get really stressed about what comes next. Am I good enough? Am I going to be able to get this internship? Am I going to be able to get this job title? Right? Am I going to be able to make a certain amount of money? And I think that if we let the work guide us, the recognition will come, the titles will come, the pay will come. And I'm not saying don't negotiate your salary, especially ladies, negotiate your salary, save for retirement, like all those things, right? You need to look out for your own financial well-being. However, let's not let that be our primary motivator. If we remain focused on doing the work and having an impact, all those other things can come. And I really believe that in my spirit. Had I known at 22, when I was entering my career, that 10 years later, I would be getting sworn into Congress, I might not have been as stressed. I would still have been ambitious, right? I would still have been a dreamer and, excited to jump into my community, but that level of stress that we just carry with us. And I think I want to be really clear. There's a generation, and I know that this isn't everybody's lived experience, but I think that, the Tisch College student can probably relate to this, who's been pushed to achieve throughout our lives. And we want to have an impact, and we want to do cool things, and we see our peers just excelling, and we want to rush and do that too. That maybe we aren't finding satisfaction or taking the opportunity to explore and solve problems that others don't see because we're just chasing that title.
It's great advice. It's great advice. We're going to turn to a couple of students now, and I believe that our first questioner is Stephanie. Stephanie Cook, there you are. Introduce yourself and ask your question.
Hi, Stephanie.
Hi, thank you so much for speaking with us today. My name is Stephanie Cook, and I'm a dental student interested in what I can do as a dentist to support access to routine dental care and public insurance options. So I was wondering if you had any advice for practicing clinicians about how we can contribute to public health policy.
Oh my goodness, I love this question so much. So I am in my district right now in Northern Illinois, and we are here for 2 more weeks. The Senate, all the 100 senators are home in their communities. All members of the House are in our communities. And we are here to do work in our communities. Site visits. I went to go see a vaccination. Hello?
Oh, you there?
Okay, I can't start my video again, but.
Okay. Oh,
okay.
There you are.
So we're out and about. Please invite your member of Congress to come and see you at your workplace. I think a lot of us take for granted, particularly as clinicians, the way that members of Congress are also human beings that might have personal experiences, that then you assume that they understand the scope and breadth of the work that you do. Let's not make that assumption. Please reach out to your member of Congress, invite them to come see you at your workplace or at your school, dental school, and get that full tour. Please be in touch and request a meeting, even with staff. Staff are the experts. And they are able to take, let's say, a 30-minute meeting, whereas I can only sometimes take a 15-minute meeting, and make sure you're building that relationship to become that resource for that congressional office, because we have the opportunity to vote on a variety of dental, for example, related issues, on Veterans Affairs. How can we cover dental health, right? Like oral health, and how can we make sure that we're not perpetuating some of the barriers that are in place, right, for that kind of care and coverage. Obviously, we're trying to get Medicare to cover dental care, and people need to see you at work and learn about your professional issues. So invite them to come visit. I love field trips, and I think most other members do too. And so I'm looking forward to being out and about over the next 2 weeks.
Terrific. And now I'm going to call on Anne. Hey, Anne.
Hi there, I'm Anne Greenawalt. I'm actually an alum. I graduated in 1981, studied electrical engineering and political science. And thank you for coming. In light of how inequitable our healthcare system is, what do you suggest we white people do to help reform the current system, the way it's currently operating?
Well, I think it's just about what we each can do. And that's about speaking up when you see injustice, examining the things that are within our control. And so if you're a clinician, right, examining the biases that you may bring as a clinician, both implicit and explicit, right? Implicit is, oh, I didn't know that I had that bias. Explicit is, racism. and we have to do the work on both sides. I think as a community member or a consumer of healthcare, I think offering feedback around barriers that you see and experience, or those of other community members that you're connected to, those need to be verbalized to folks in charge of our local healthcare systems. I think that we make some assumptions about the level of awareness within our both public health infrastructure and our hospital and healthcare systems that serve our communities. Those folks need to hear from you. And that's not limited to you as a white woman or me as a Black woman. It just is engaged members of our communities. It's so important.
Thank you.
Thank you. Lauren.
Hi.
Hi there. My name's Lauren, another millennial Lauren. I'm a first-year medical student at Tufts, so thanks for coming and talking to us today. My question is kind of along the same veins and something that you've talked about a little bit, but mistrust in the government and medical institutions has definitely been growing for a number of communities for a whole multitude of reasons. And I was wondering, as a representative of kind of both of those larger institutions, how do you work to repair that trust, and how can we as students help?
Yes. Okay. So this has been so interesting in the COVID conversation, because, I do a lot of work on Homeland Security. And last year, I was, for part of the year, the chair of the Cybersecurity Subcommittee on our Congressional Committee on Homeland Security. And what we found was that, for example, the Russians were behind a misinformation campaign that said that Black Americans were inherently immune from COVID-19, that Black people just didn't need to be worried about it, right? So blatantly false. But folks were being fed that kind of a message on their social media. Then there's, some of the things that we are all very familiar with that, were immoral, unethical actions that were taken to harm certain groups of people. And the legacies of those actions continue forward where there is some mistrust. But we also see during COVID, for example, that there's also just like barriers to accessing care, barriers to accessing vaccine. And so everyone who, for example, isn't vaccinated doesn't have mistrust. Sometimes they just can't get the vaccine, right? It's not in their communities. And that's why you hear some of this like equity conversation. We're going to target the vaccine to the communities that need it the most. I think it's really important for us, particularly as policymakers, to kind of tease out those issues. There's a whole group of African Americans who are desperate for a vaccine. They want it, they can't get it. They're in medically underserved communities and can't get it. And, folks talking to them, preaching at them, trying to convince folks to get vaccinated doesn't solve that problem of being unable to get the vaccine. For example, right now in this country, today, the number one group that's vaccine hesitant, white Republican men. The number one group. And, so that's like a different nuance on the conversation. But in terms of how do we solve this larger issue about mistrust, we need a diversified healthcare workforce. We need to embrace healthcare interventions that are evidence-based and proven to work. So for example, the answer is not, in my opinion, and I think that the evidence backs us up, to give every, Black person in an underserved community a smartphone and beam in a Black healthcare provider through telehealth, right? That is not a proven intervention for every ailment, for every community. We need to follow the evidence. And we, as the Dean Solomon said, sometimes we see in the evidence that when you have provider choice and some commonalities with that provider, you have better outcomes. We need to invest in diversifying that healthcare workforce. And I think also we need to show our work. So for those of you who are maybe studying to become executives in our healthcare systems or working in healthcare systems, right? This is something that we need to be actively talking about. If you have underserved communities that are within your, geographic area, make sure that they know the efforts that your healthcare system is taking to serve them, to reach them. And I don't mean, some half-done effort to, pass out stickers at, a Cinco de Mayo gathering, right? Like, that's not what we're talking about. But, really demonstrating that commitment to equity and inclusion and making that a core principle of the work that you do in your care approach. I think that a lot of systems maybe have this fatalistic approach that they're just not going to trust us. No, it's your responsibility to help earn that trust. Trust is earned in every relationship that we have, right? And so why would it be any different within the healthcare system?
We have another questioner in the audience, Dana. Hey, Dana.
Hi, Dana.
I got you. Mute was challenging. Thank you so much, Representative Underwood, for championing veterans benefits. I have watched you on a lot of congressional hearings for the past 2 to 3 years. So it's been quite awesome to see you champion veterans. But my name is Dana Allman, and I'm a veteran. I'm retired lieutenant colonel with over 23 years of active duty service. I have drafted 2 Senate bills that are focused on VA healthcare quality and access, as you talked about. Quality and access to VA care is paramount. So I have areas that I'm worried about, and those are daily suicide prevention and post-prevention, sexual assault and harassment prevention, patient care, governance practices, stable and adaptive leadership, strategic planning and management, and healthcare access. So I'm quite curious to find out what the House Committee on Veterans Affairs is doing. We know that is working on. We know that there's been a lot of deficiencies found in Government Accountability Office and Veterans Affairs IG reports, and that's definitely been a concern. So I was wondering what the committee is working on to get after that.
Okay, well, first of all, ma'am, thank you for your service, for your many years of service to our country. I'm so delighted to hear that you've had this opportunity to craft some legislation because we need those kind of first-hand feedback and ideas from folks who are using the veterans healthcare system. So reducing suicide has been a primary focus for the committee since I've served on it. And as I approach this work, we are guided by the data, which tells us, right, you're familiar with the statistics, 22 veterans are dying by suicide every day. Half of them are not connected with the VA for care. Now, a lot of the congressional action hears that and focuses on finding those veterans who are isolated and alone and suffering in all of our communities and trying to connect them with care. That's important. But one of the things I've just been really fixated on is, well, how can we improve the quality of care within VA so that we're still not losing people who have been seen, who are connected with care? And how can we incorporate some of the evidence, the data that we see throughout our civilian healthcare system and apply it within the VA? There are evidence-based solutions that work. And one of them is something that I am very excited about. It's called lethal means training. We know that many of the veterans who are dying by suicide are doing it with firearms. And there have been, I would say, some hesitation and reluctance to have a very candid conversation about the role of firearms in veteran suicide in this country. And so as a result, some of the training that clinicians and other staff are provided, one, maybe not as comprehensive, and two, are not mandatory. So for example, maybe all the psychiatrists are required to get lethal means safety training, but that frontline receptionist who's interacting with the veteran when they first walk in the door, the medical technician, right, the nurse, you know, the person who's checking you out, anybody else on that continuum that the veteran's interacting with at the clinic or at the hospital is not required to understand that lethal means safety training. Well, we know because there's been so many high profile examples, veterans coming in for an appointment and then dying by suicide in the parking lot after their appointment, right? We are missing these opportunities to intervene. What our legislation does is it requires this training so that everybody in the VA is unified in this idea of how we can save lives, how we can intervene if someone is in distress, and how to help that person get the help and care that they need while they're on site. The evidence is robust. And what's wild about this to me, if I can editorialize some more, is that the Trump administration, they came in and testified and they asked us to do this last Congress. And my colleagues on the other side of the aisle were less enthusiastic. So we're bringing it back. And we're doing the work, and we're hoping to get it signed into law this year because we know how important it is. And we have a commitment from the new Secretary of Veterans Affairs, Secretary McDonough, who understands the value of this intervention to work with us to make sure it's implemented. So I'm excited. That's just an example of the work that I'm doing. But I think that, you know, we've pursued a pretty comprehensive approach to suicide prevention, for mental health support, and, you know, to improve the care quality that women veterans receive around this country, which we know has been inconsistent at best, but really has some room for improvement. Thank you so much for the work that you're doing and for being with us today.
Thank you so much.
Thank you very much, Dana. Congresswoman, we've reached the end of our hour, but I want to just say thank you for joining us. This was really terrific. You know, a friend of mine, a former member, I don't mind name, Chet Atkins, told me some time ago, he said, you know, this young Congresswoman is a superstar. You should really get to know her. And I can see why he said that. So thank you very much. Thanks again to Suzanne Seiden who was a big fan of yours, as you know, and for helping. And Katrina Moore, I appreciate you. And let's stay in touch. And as the Dean of the College of Civic Life, I'll remind you that the Civic Secures Democracy Act is looking for some more co-sponsors. So that's for a different part of our population that I think desperately needs civics education. So thank you so much for being with us, and take good care, and thank you for your service.
Yes, sir. Thank you for having me. Take good care of yourselves, everybody.